Hello, my name is Dylan Bradley and I'm an American Red Cross certified lifeguard. As a lifeguard, our primary goals are safety first and injury prevention. Unfortunately, some medical emergencies, such as someone who is in cardiac arrest, is unable to be prevented. As a lifeguard, we are trained to perform CPR, or cardiopulmonary resuscitation, to help victims in cardiac arrest. In the next few minutes, I'm going to explain how to perform CPR. Now, according to the demographics survey, everyone else is around the same age as me, which means that anyone that can become certified in CPR. Becoming certified in CPR can help increase their survival rates. CPR is a very effective life-saving technique used by trained professionals for someone who is in cardiac arrest. CPR is mouth-to-mouth resuscitation with chest compressions combined. It delivers oxygen and artificial circulation to the victim, and is used for someone who is in cardiac arrest and should not be used otherwise. The first step in performing CPR is you want to size up the scene. Sizing up the scene means that you want to make sure that the scene is safe enough for you to approach the victim. You next want to apply PPE, or personal protective equipment, such as gloves, a mask, or a CPR mouth barrier. You then want to check vital signs. This should take you no less than 10 seconds because you do not want to waste time. This means checking the ABCs, which is airway, breathing, and circulation. You next immediately want to call 911. You then want to lay the victim on the ground on their back and open their airway by applying a head tilt chin lift. You want to tilt the head backwards slightly and lift the chin open towards their chest to allow air to go in. You will then start CPR by providing 2 rescue breaths first. You want to use a mouth barrier or CPR mask to eliminate the mixtures of bodily fluids. This is what a CPR mask looks like. You want to apply the pointed end towards their nose and make sure that it covers their nose entirely. You will then apply breaths through this opening here with your mouth. There is also an inlet here for oxygen. You will then begin compressions. You will use 30 compressions and press the chest down 2 inches deep. You want your hands at the center of the chest where your arms extended and locked, and all of your body weight should be on your arms. You should be compressing at a rate of 100 compressions per minute. After you've completed 30 compressions, you have now completed 1 cycle of CPR. This cycle should be continued until an AED arrives. The only reasons to stop providing CPR is 1, if the AED arrives, 2, if the responder becomes too tired to continue, 3, the scene becomes unsafe for the responder, 4, EMS arrives or higher trained personnel, or 5, the victim comes back to life or shows some form of breathing. Once the AED arrives, you want to connect the AED and the following instructions provided by them. The AED will talk you through each step of how to provide care. The earlier the AED arrives, the better survival chance of the victim. The survival chance decreases 10% per every minute after 3 minutes, so you want to make sure that the AED arrives within 3 to 5 minutes. In conclusion, becoming certified in CPR can lessen the number of lives lost due to medical emergencies such as cardiac arrest. Thank you. Here are my note cards.